Hello, I'm William Zoghbi. I'm the Chief of Cardiology here at Houston Methodist and the DeBakey Heart and Vascular Center. And it's a pleasure having Dr. Steve Nissen, the Chair of the Department of Cardiology at Cleveland Clinic. Steve, what a great grand rounds this morning.
Well, it's fun to be here, and thank you so much for having me.
It's a pleasure. And I'm so glad you picked this topic of Lp(a) and as a new marker and hopefully a target. As you could tell from the audience, not too many people are tuned in yet into this, and I think it's going to be, in a way, revolutionary because it's going to be a new marker for us, hopefully, to target.
Yeah, I think so. It's interesting. When we don't have therapies for something, there's not so much incentive to actually measure it and think about it. But as now new pharmacology using gene silencing is going to enable us to lower levels of this very noxious lipoprotein, it's going to become increasingly important that we all know about it and understand it.
It is fascinating that this new gene silencing is also in other areas, even in just LDL cholesterol.
Yes.
Right? And it looks like the beauty of it, hopefully it is safe, and it looks like the preliminary trials are safe, and we're looking forward for the big trial from this, is also for LDL cholesterol is going to be safe too. So we do hope that maybe with an injection every few months that you'll have maybe better compliance and hopefully good safety. So I think it'll be fascinating.
Well, it is fascinating. Now, of course, these drugs will tend to be a little bit more expensive than the small molecules that we're used to giving. But again, I'm hoping that industry will be innovative at helping reducing the costs of these things. But there are simply targets that we have no other way to address, and this is one. I mean, there's no other way to lower lipoprotein(a) very effectively than to actually turn off the gene that makes this lipoprotein.
It's really very exciting. A question, I don't know if we know the answer for this, but I was intrigued also of the effect of at times statins or PCSK9 on Lp(a).
Yeah.
And you made a case certainly that at times if LDL cholesterol doesn't decrease significantly, maybe Lp(a) has increased. Do we know the mechanism of why in one, obviously they work in different mechanisms, but do we know why in Lp(a) may be increased with a statin? And does it depend on the actual drug of a statin as opposed to a class?
It looks to me like from the data, and again, there's not very robust data that all the statins raise lipoprotein(a). They don't raise it very much, but it doesn't go in the right direction. And so, one of the ways to look at this is that people do much better on statins in spite of the fact that they increase lipoprotein(a). But for some patients who have both markers elevated, the idea of treating both components of atherosclerotic risk, that's very exciting.
That is very exciting. And the other thing that you touched on, which probably will support the hypothesis of the importance of atherosclerosis and valvular heart disease.
Yes.
And talking about, yes, therapeutically we haven't seen that yet as to, but if you look at Lp(a), if you look at LDL cholesterol, looks like the relationship is there, and the question is when to intervene. Some of your thoughts, I mean, how early are we going to be able to intervene to see a change?
Well, it is a bit of a paradox because if you wait too late, you've got a rock-hard calcified valve, you're not going to probably do anything favorable for it. But if you treat it early, it may take 10 or 15 years for lowering either LDL or lipoprotein(a) to show a benefit. And nobody does trials that go on for 10 or 15 years. So we got to find the sweet spot. When can we affect aortic valve disease by changing the atherosclerotic risk profile of a patient? And I don't think we know the answer to that. Not yet.
Well, this is really a very exciting field. And we look forward, hopefully maybe next year or the year after, to come and update us on what's really going on in Lp(a). And maybe the trial would be launched to take a look at the effect of it. So I think this is an amazingly exciting field.
We're very excited about it. It's a new opportunity.
Well, I certainly would invite you to take a look at his grand rounds. It really is an eye-opener and an amazing update on the field. So thank you very much, Steve, for joining us.
Thank you.
A pleasure having you.
You too.